Thank you all very much. I think there's time for a couple of questions. Jean?
As you mentioned, the neuromuscular junction is a very classical model to study synaptic transmission in the whole field of neurophysiology. And of course, the dialogue is bilateral because the motor neuron induce the response from the muscle, but the muscle is also involved in producing growth factors that could affect the survival of the motor neurons. And would it be possible that in a long-term sarcopenic model, progressively there is a defect of the motor neurons themselves, not only on their functioning, but maybe even on their survival, long-term survival, due to a deficit in growth factor? It at least is something that could be tested. And then the sarcopenia is not only a muscular disease, but could become a neuromuscular disease involving the motor neurons.
I mean, I think you're definitely right. Well, we actually just did a study where we used a myostatin inhibitor, follistatin, to increase the size of muscle and see what kind of effect. Our hypothesis, and I tell my lab that normally my hypothesis is wrong, but I thought if the muscle was enlarged, it might put more strain on the motor unit, but actually enlarging the muscle made the NMJ transmission and morphology better. So definitely there's a crosstalk. And I also think, and this might be more in the realm of what Thomas can answer, but I think like improving that transmission also could have a hypertrophic effect, like an additive effect with exercise and things like that. So definitely I think signaling is bidirectional.
Yeah, I just want to, I fully agree with what was said here, and I think nerve and muscle is probably some of the most plastic tissue we have. And therefore, I think we have many situations where you lose either muscle function because the nerve is not working or vice versa. So by bringing back function, I think we can preserve integrity. And I think that actually also is quite relevant for other, let's say, more aggressive and more rapidly developing neuromuscular diseases, such as some of the motor neuron diseases, where if the deficit at the junction is quite pronounced, you are not getting the trophic signal from an active muscle back to the motor neuron, but also the sheer fact that you're not active. Coming back to the point about being active, being able to actually carry your own weight and stuff of that nature is really very, very important here. And it's hard to tease things apart, but maintaining function, I believe, will have an effect on the integrity of the tissue.
Professor Nerici.
Thank you. I really enjoyed your presentations. I wanted to ask, some of these changes at the neuromuscular junction sometimes precede functional changes. The morphological changes precede the functional changes. Have you looked at the timing of the onset of changes in the neuromuscular junction?
So the first study was actually, all these studies have been cross-sectional. So we don't have a timeline for rats, but we have it, or humans, not old enough yet, I guess. But in mice, we've done a timeline from like maturity at a year of age all the way out to 29 months, about at 3-month intervals. And what's interesting, historically, we've shown motor units drop out at about 20 months of age. We've shown this in up to 300 mice at this point, but we published this a few years ago. And so our hypothesis was motor units would drop out, and then the remodeling would be associated with NMJ's secondary defects. Not at all. Again, my hypothesis was wrong. We didn't see deficits in mice until after 2 years of age. So in mice, NMJ failure seems to be a relatively late stage, and I don't know if it's like reaching the capacity to maintain that remodeling state. Maybe. I don't know. I assume that's probably what's happening, but I think relatively this happens earlier in rats, but we have not mapped it out. So.
Thank you. And have you also looked at the complexity of the signal? Because this reflects the speed of transmission of the action potential along the fibers, and heterogeneous transmission may indicate a pathological state.
That's the big difference between the decomposition EMG technique and this technique. So here we're at a level of a fiber potential that's stable, all or none. The rise time has to be really sharp and a certain amplitude. So it's either there or not. Where it's motor unit potential fluctuates, the jiggle phenomenon that I think you mentioned earlier. So that's the difference. And jiggle could be related to conduction velocity, where blocking, it's either there or not. So it's direct evidence that it's failing. It's harder to do than the other techniques, so there are some benefits of both. But that's the thing. I'm glad you asked that question, because that's what I wanted to talk about, but wasn't sure I had time.
Thank you.
Yeah, thank you.
Just a quick question. Have you administered the ion channel inhibitor and just looked at the animal behavior? What happens when they get it chronically?
Well, we haven't sort of we have not sort of made any videos of it, but a number of our studies have been conducted at CROs, and we have had reports back that they had guessed, even though they were blinded, which group had been given because they could see that the animals were behaving better. This was particularly pronounced in the myasthenia animals, who were also very severely affected.
Thank you. Thanks. Very interesting. Thank you for a really excellent set of presentations and a really great symposium. I'll turn it over to next session.